accessibility of care to all segments of society is extremely important. And in order to do that, I think there are many aspects you mentioned, like, for example, research. There are fantastic institutions which are coming up, like, for example, the Brain Research Institute in IIT Chennai, which is being completely funded by philanthropic effort. So many such institutions of excellence have come up across the country. Research is happening, but one of the most important things in the preventive side which is happening is the wellness center concept which the government is creating. So that is going to essentially screen people for non-communicable diseases as well as some of the infective diseases. And one of the major programs which government has taken on called Nikche, which is about TB-free India by 2025. So that is a pretty lofty target, because tuberculosis is a big problem for the nation, and it causes a lot of burden on the healthcare infrastructure in the country.
Now, you know, the Prime Minister has done something pretty remarkable in One India, One Ration card. Where do you see universal healthcare, and how do you see it coming into India? For instance, insurance, health insurance, cashless insurances for the well-heeled and the rich. How do I actually access healthcare, no matter which part of the country I'm in, and access it without fear of favor? Do you believe, in your role as the head of Nat Health, there's something that you can advise through your organization and yourself, the government, in terms of what it needs to do?
See, one of the points which you touched earlier is the creation of the infrastructure. But as I was saying earlier, the digital highway which is being created, that will lead to a lot of development on the sides of the highway, just like a regular highway has. And that is what is going to get infrastructure going into these areas. I think one of the focus should be on how to make private investments attractive in other areas, not only on the provider side, but there are many other components of the healthcare ecosystem. If you look at the manufacturing, for example, for equipment, biomedical equipment, pharmaceuticals, etc., that's essentially all private sector, and that's what supports the public sector as well. So the private sector and public sector are greatly intertwined. So I think the policies to make investment in healthcare attractive. Healthcare cannot be just like any other business. Healthcare has to work with a slightly altruistic motive. And in order to deliver that kind of care at the last mile to those who are disadvantaged, it is very important that the investment comes into private healthcare in all the components of private healthcare, whether it is manufacturing, whether it is service delivery, whether it is diagnostics.